The great thing about Expo is the opportunity to meet lots of different people from across the country doing some really fascinating things, and quite frankly take their ideas and think about how you can apply them in your particular health community. In my case, that's Tower Hamlets. The highlight of my event has been a great buzz, talking to people, finding out their ideas, the positivity actually. I think the thing that I always find at Expo is you go away re-energized by people's enthusiasm, because most of what you hear in the newspapers is negative, challenges, cuts, all that sort of thing. Actually what you get here is enthusiasm, optimism, a lot of good ideas. And that you go away on a high, quite frankly, when you spend time with people that you meet. I think some very big changes about the way we're going to do things differently in the NHS. So some examples of that would be, for example, the philosophy that anything you do to save patient time is good for patients, but actually is good for staff and it's better value for the NHS. There's something about a philosophy that's emerging from the vanguards, which is moving away from how we were trained as scientists, which was define what the matter is with somebody and here's the treatment, to what matters to them. And that's what the whole social prescribing movement is about, which is absolutely taking off in the vanguards. It's saying that 70% of people's health and well-being is nothing to do with what we do in the NHS, but is our responsibility. And that's about actually talking to patients about what matters to them and what are the things that are really going to change their life. And I suppose the final thing is an understanding that actually it's not going to be wonder drugs or super cancer treatments that are actually going to make the difference to people's quality and length of life. It is absolutely about the lifestyle choices people make. And I think there's a massive recognition that was started in the 5-year forward plan that actually the new way forward was A, to shift care out of the hospitals into the community and to primary care, but most importantly actually support people to manage their own health care. And that's what enabling people to access their notes is all about. It's why I give my patients with terminal illness my mobile phone number. It's actually about empowering patients to make the changes that matter to them in their life. And it's not the traditional approach, which was, doctor knows best and all we need to do is tell people what to do. And somehow they'll magically do it, because guess what? They don't. So on a personal level, I love talking to all the people involved in the vanguards because they are so bubbling over with ideas and enthusiasm. And I also know that all the innovations we've ever done in Tower Hamlets, a lot of it is not new stuff. It's taking ideas from elsewhere and actually applying them locally. So it's actually picking up all those ideas. And therefore it's thinking constantly, because the vanguard movement is not just about those individual 50 or so vanguards. It's actually about, well, how do they help other people on that journey? And not necessarily a journey which is to take some of the big steps the vanguards have, but what I call almost new models light or vanguard light. In other words, recognising that actually change in the NHS does take a long time, but actually what are the bits on the journey that you can start now that are going to reinforce a sense of success and change, rather than feel that actually the challenge is so overwhelming there's nothing we can do.